Hello, I'm Dr. Jeevan. I completed my MD in Community Medicine from the Christian Medical College, Vellore, and I'm now serving as a community health physician. Today, we are going to learn about the symptoms of COVID-19 infection. As in most other diseases, even in COVID-19 infection, there are quite a large number of patients who will remain totally asymptomatic. As of now, we know that approximately 80% of COVID-19 infected patients will remain either asymptomatic or will have only very mild symptoms. Now, signs and symptoms of COVID-19 can occur 2 to 14 days from the time of exposure to another COVID-19 infected person. The common signs and symptoms, they can either occur together or can occur alone or in isolation. The first symptom that usually patients have is fever. It can be with or without chills. The fever can be of varying durations ranging from 1 day to as long as 15 to 20 days. The second symptom that patients usually have is a cough, which is usually dry, but there is no hard and fast rule that you should have cough. The third symptom that one can have is tiredness, unexplained tiredness. Many of the patients that we have seen in our clinic who turned COVID-19 positive came with only tiredness. The fourth symptom that we see is a loss of taste or smell. The fifth symptom, which is actually a dangerous symptom, is a shortness of breath or difficulty breathing. I should emphasize that if you have a shortness of breath, that is a definite symptom that needs to be shown to a doctor immediately. The sixth symptom that usually have is myalgia, also called muscle aches, body aches. The seventh symptom that you can have is chills without fever. The eighth symptom is sore throat. The ninth one is you can have a cold or a runny nose. The 10th one is a headache, unexplained headache. 11th symptom that you could have is a chest pain. 12th symptom is an unexplained rash. 13th symptom is nausea followed by vomiting and even a stomach upset, a tummy upset, a diarrhea. In elderly people, we often see patients to become confused. When they wake up early morning, they appear totally confused. They do not know where they are or what time is it. This is it can be seen in elderly patients. The last but not the least are eye problems, which involves enlarged red eyes, swollen eyelids, excessive watering and increased discharge from the eye. Now, after having told all this long list of symptoms, I should again emphasize that approximately 80% of the patients will not have any symptoms, or even if they have symptoms, it will be very mild. Now, why is this important? One of the reasons why I think that knowing about the symptoms is important is that many of our patients are refusing to get tested for COVID-19. Now, if you refuse to get tested, there can be two problems. You may be going from one doctor to the other. Many a time you may be going from a medical shop to a quack. You could end up being unnecessarily treated with antibiotics, painkillers, and anti-anxiety drugs, which could do your body a lot of damage. The other reason is you could unknowingly spread the disease to many others, and ensuring that the epidemic spreads very, very fast. I hope that this video will help you to take a decision to do your tests if you have any of these symptoms before exploring on the presence of any other disease. Thank you. Thanks for watching. Please share this video to all your friends. Bye.